I'm your host today, Fabiola Balistreri, functional medicine practitioner, and today we're going to talk about HBOT, Hyperbaric Oxygen Therapy, with our guest, Filippo Besozzi, founder of Physio2Sport, based in Geneva, Switzerland. Thank you for joining us today, Filippo.
Thank you very much for having me there. Hello, everyone.
So, tell us a bit about yourself and how you got into this.
Okay, so I came from a sport field, as I did sport for like most of my life. Since I'm not that old, and it seems maybe I am a bit, but I did lots of sport during my life, and so that's why I decided to be actually involved in sport even the moment actually I dropped the sport career. So that's why I started to do physiotherapy, to study physiotherapy at the university. And with research, with experience, I try to find out what's the best thing actually to help people feeling better, athletes or normal people. And so I decided one day to say, okay, I really like to create something that really can help people. And so I did some research. I said, what can be the best solution? And I found out that hyperbaric oxygen therapy is could be actually a really good weapon when we're talking about physiotherapy, helping people feeling better, and according to research, etc. So I decided to create my own place here in Geneva, where, as I told before, I do classic physiotherapy, but I start to using also hyperbaric oxygen therapy during my daily activity, and seeing great results so far.
Wow, okay. So you use it on yourself, but now you also use it on your...
I used it on myself when I was an athlete. Doctors, researcher, and told me that at the moment that hyperbaric was a really good thing to help me recover faster and better. And so I really used a lot on myself before, and now also I'm using a lot, and I'm using a lot also in my daily activity with my patients.
That's amazing. And after how many sessions did you feel that it started working?
It depends of the condition of each person. Let's say that if there's no specific condition like neurological disorder or some like chronic issues, let's say that around the 15-20 hours of treatment, that corresponds to more or less 15-20 hour session, you really feel that there's something different in your body actually.
Okay.
Before that, maybe you can start feeling something, of course. At the moment you finish the first session, you feel that something is going on in your body. But
what do you feel after the first session?
You feel like that you have more energy, because you're giving your body this huge amount of oxygen, that maybe we discuss later about how it works. And so because you're giving this huge boost of oxygen, and because our body works on oxygen at the end for every processes inside the body, it's like you have this huge boost of energy, and maybe you can sleep better actually the same night, or you think that you can say that maybe your brain is more efficient, less fog in your brain. So and then it's really something personal, because it depends actually on what's your problem at the end. Okay. So everyone reacts in a different way based on what's its condition.
Yes,
okay.
yes.
But let's say in general, after the first session, you feel like more relaxed. Let's say you feel good. That's the most important thing. That's the most at the end. That's the most important thing. You feel good after the session. Actually.
Yeah. And anyone can do this session, or if there is any risk or any contradiction?
Let's say that the moment you're able to equalize your ear, okay, you can get into the chamber. Okay. It doesn't matter age or sex. I mean, nothing. Okay. It's just the moment you are able to equalize your ear, you can go inside the chamber, because it's like going into the plane at the end.
Okay.
Pressure increase, ear starts to be blocked. Okay. So you have to equalize. And then, of course, there are some general contraindication, like, for example, pneumothorax. This is the most important condition. If you got this condition, for sure you cannot get inside the chamber, if not treated, of course.
Yes.
And then there are some, like I call it yellow flag, not really red flag, like, for example, pregnancy. During pregnancy, of course, you have to be careful about everything.
Yes.
But still, because it depends on which period of pregnancy you can benefit from this treatment. and
Okay.
but you really need to talk to your doctor, etc., etc.
Yeah.
And for example, also some kind of cancer, maybe it's better to have the green light from your doctors. Let's say the general red flag is pneumothorax,
Yes.
non-treated pneumothorax, and if the person has been through a barotrauma, so he's got a problem in the inner ear, so he's not able to equalize with ear. Let's say that.
Okay, thank you. But and I thought maybe if I take the plane, I should not do a session, right?
Why not?
I don't know. I always read that you cannot do a session if you travel.
If you travel, but it's funny because you can benefit a lot from for example, jet lag situation.
Okay.
You do a long flight, maybe you come back from, I don't know, US or Asia, where you got at least 5, 6, 7 hours of jet lag. You get into the chamber, you help your body to reduce the stress, you oxygenate your brain, your muscle, so of course you can benefit from that. It's not a problem of because you've been through a long flight before, then you already spent 12, 13, 15 hours in an hyperbaric situation, that you cannot enter the chamber.
Okay. So I can, the day after, I can come and do a session, no
Even
problem.
the same day you can come.
Okay,
actually.
that's good to know.
You just get off the plane, you take the train, you come here, you get inside the chamber, and you feel great
that's
at the end.
perfect.
Yeah.
Okay, it's very good for the jet lag.
It's amazing actually for the jet lag.
Fantastic. Describe us a typical session.
Okay, typical session. The patient arrive here. There's a data collector actually, because we have to be sure that everything is okay with the person. The reason why it's there, if there are some medical condition that we need to be aware of, if the person is taking some treatment, medical treatment, that maybe can have an impact on the efficacy of the treatment. And then after that, we check also the pressure, if there's no problem with pressure, and we do a simple test to check if there's no problem in the ear. Once everything is done, the person go into the chamber, just taking off shoes. Okay, you can go inside the chamber. We are here actually are not that bad because there are lots of light, natural light coming inside, so there's no risk of claustrophobia effect attack. The person goes inside the chamber with their own clothes. There are pillows inside, so it's super comfortable. The moment we close the door, we seal the door, the pressure starts to increase. And during this increasing in pressure, the person starts to breathe pure oxygen, okay? With a mask. Then you reach the treatment pressure, okay? It depends on condition and other parameters. And then the treatment lasts more or less, it can last at least 1 hour. It can be 1 hour, 1.5, or 2 hours, depending on which kind of condition that this person have. At the end of the session, the pressure, we open a valve, we control the pressure, so the chamber starts to decrease, the pressure inside the chamber starts to decrease, and then the person is free to go whenever we open the door again.
Wow. And after that, the person has so much energy.
Yeah, actually, depend. Okay, you can feel really relaxed, or you can feel super energized. Depend on the person. Depend on also. This is actually what I found with daily activity, on which moment of the day you do the treatment. Actually, okay.
I see.
But everyone reacts in a different way. But in general, there's always a good reaction after the treatment.
Okay. And what is the condition that you see the most?
The condition we see the most, especially now, and I think it's a general situation all over the world, is the long COVID situation.
Okay.
Long COVID, it means lots of things actually, because we can have different conditions related to long COVID. Okay.
So give us an example of
general fatigue, for example. People feeling super tired. Before COVID, they were able to do lots of sport, for example, or but now they're not able even to climb stairs, and they're super tired, for example, something like that. Or sports recovery. Lots of people coming here because they do lots of sports, so they come here after a workout session or a long period of high intensity workouts. They come here to recover better, maybe because they got some little inflammation they want to get rid of. Or for example, we have also people coming here after chemotherapy or radiotherapy treatment.
Wow, that's super interesting.
To help body healing faster or reducing the side effects of their treatment. Okay. Ongoing treatment.
And what kind of cancer the patient have?
Different. Let's say now it's a period where we have breast cancer patient here. They went through surgery, and then here after the surgery, during the treatment, for example, chemio or radiotherapy treatment. And this treatment actually it has been proved that help people to reduce the side effects of chemotherapy, help actually reduce side effects of radiotherapy, or increase the efficacy of the chemotherapy treatment.
Okay. And this people that have this cancer, they need to do how many sessions? Like after how many sessions you see actually they start to feel better? And
it's more or less the same thing I told you before. Let's say around 15-20 sessions is where actually they say, okay, now I feel that there's something going on in my body. It's not just the effect of the single session. I can say that there's something stable in my body. I feel the difference.
And this is like every week or every day they have to do, like?
Let's say the better is the more treatment actually you do, the faster you get results. Okay. So it's really related to people availability. So if you're able to come here every day, it's better. Okay. For some specific condition, we force people to come here, for example, every day, because otherwise the treatment takes so long, and it's a waste of time and a waste of lots of things. Okay. So in general, let's say that for normal condition, 2 times per week, it's good, especially at the beginning when you start the treatment. So you give your body a huge shock, and then you can increase the time lapse between every session. So for example, you start twice per week, and then you go to 1 per week, and then 1 every 10 days, and then you start maybe to do twice per month for a period that you can choose. Let's say this is something that when you start, maybe you can do for the rest of your life, because it has so many benefits, not just for treating a condition that you have today, but also for preventing further condition that may you have, because maybe in your family there's someone suffering from chronic condition or degenerative issues. So you have to see this treatment like something that can help treating acute condition and also to prevent chronic condition.
Okay.
So the frequency, it's really based on what's your goal, for sure. Okay. Sport recovery, for example, doesn't require the same amount of session than Alzheimer's disease, Parkinson's disease, or post-surgery treatment. As I told before, if you're able to come here every day, of course, you can feel the results faster than if you can come here only, for example, 1 per week.
And you can do the session every day without any contraindication?
You can do every day with no contraindication. And sometimes for specific condition, you can do also multiple times per day.
Okay.
Can be 2 or twice or 3 times per day.
Wow, that's crazy.
But that's really for really specific condition.
Give us an example.
For example, carbon monoxide poisoning, for example. So super specific, or decompression sickness for scuba diver.
Okay, I see. And I see that there is hard and soft chamber. There is any difference?
The difference is on the pressure that you can reach inside the chamber. Of course, soft chamber are less powerful in terms of the amount of pressure you can put inside. In general, soft chamber reach 1.5 ATA, absolute atmosphere, while hard chamber can go up to 2.5, 3, or 4 ATA.
Okay.
What's the difference? Hard chamber are the medical one, let's say that, while at the same time the soft chamber is the one that you can have at home, for example, for your personal use.
Okay.
So it's at the end, it's not that the soft chamber it's not effective. It maybe just require a bit more of session in order to achieve the same result that you have with an hard chamber with a higher pressure. And there are some conditions that requires higher pressure in order to be treated, to be effective. But let's say that in general, if a person comes here with no specific condition, even a soft chamber could be good. Because at the end of the day, what's the most important is increasing the pressure, okay, while breathing pure oxygen. The moment you increase the pressure, there are lots of good things happening inside your body. One of the most important things is, for example, that you increase the concentration of liquid oxygen into your blood. Usually, and 1 atmosphere, so the atmosphere and that we have here, the 21% of oxygen that we breathe in normal air. In our body, we have 0.4 milliliters per 100 milliliters of liquid oxygen in blood. Okay. The moment you do this treatment, as you're increasing the pressure, of course, the more you increase the more this concentration increase as well. You pass from 0.4 to 3.8, 4.4. So you increase by 10 the amount of the concentration of liquid oxygen in your blood.
Okay.
And it is huge because this is what's make the difference with, for example, a normal oxygen therapy where you don't increase the pressure.
Okay.
And then you got also other super important effects. For example, according to physics law, they say that when the moment you increase the pressure, the volume of the bubble decrease. This is super helpful for us because when you know that, you know how you can use this treatment to treat specific conditions, like for example, as I told you before, decompression sickness. This is really super important, especially in this condition. And beside that, those are the two most important effects that you have inside the chamber. You got also secondary, but not less important effects, like for example, angiogenesis. So you produce new blood vessels in your body. You can increase the activity of your immune system, having a direct impact on the leukocyte cells. You increase also the antibiotic effect in your body, reducing the toxins. And fibroblast activation. I mean, there is so many positive effects inside this chamber, during this treatment, that you can really number of conditions.
That's incredible.
Yeah.
So like everybody should do this.
I would
As a
say yes.
prevention.
I would say yes, especially so far there are lots of research about hyperbaric oxygen therapy that shows that it's super effective almost on everything. Because at the end, what's happening inside, you increase the oxygen, and because we work on oxygen, I mean, our body works on oxygen for all the processes. Mitochondrial level actually is oxygen to produce ATP, the energetic energy. So the moment you're giving oxygen to your body, you help your body to work better actually. So based on that, you can say, of course, I can use it for everything at the end.
And if we go to the mountains and we breathe oxygen, is it the same breathing oxygen in a chamber?
Not really, because when you climb a mountain, you're reducing the pressure. When you go inside the chamber, it's like if you go under sea.
Okay, I see.
Depending on the amount of pressure, you can go 3 meters, 7 meters, 10 meters under sea. So it's not really the same thing. And if you see what's happening in your body, there's a huge difference between when you go on a mountain or when you go under the sea. Because when you go on a mountain, you're inducing in your body an hypoxic situation. When you go underwater, and because you're breathing oxygen here, you're inducing an hyperoxic situation. So it's completely the opposite.
And what about now I see you can breathe oxygen. No, actually, they can inject oxygen in your blood, and this is exactly the same, or it's completely different?
I told you before, there's some different kind of oxygen therapy. Okay, I think that maybe this one I'm not really super into this one, but I think that it's more or less the same that you breathe. If you breathe oxygen, like here, if I give you an oxygen tank, you breathe oxygen. It's not bad. I'm not saying that it's bad.
But it's not the same because
you're not increasing. Exactly.
Okay.
The pressure is the key. Okay. This is what makes the difference between hyperbaric oxygen therapy with all the other oxygen therapy.
Okay. Could you share a story of one of your patients that really marked you and you could see really the difference and how she reacted?
I would say that the best reaction I have so far is this young lady who was suffering from an osteochondrosis in her right knee.
Okay.
Dancer.
Okay.
So she's stressing a lot his knee every day.
Okay.
I was treating her already. I would say at least 1 year and a half.
So you started to treating her.
Classic treatment.
Physiotherapy.
Yeah, classic treatment. Let's say the conventional one.
Okay.
So, for example, shock waves, massage, classic manual therapy. Let's say classic physiotherapy. Okay. And then the moment I introduced the oxygen therapy, I said, okay, beside what we are doing so far, try to do that actually, because it could help based on what's happening in your body. So I said, let's try to do that. After 3 sessions, she told me, I never felt that good. Like it's at least 2 years that I'm able to dance with no problem.
Wow. Okay.
So she's the one who reacts the best so far.
She reacted to
Super fast.
Yeah.
And I said, wow. So now I start using hyperbaric oxygen therapy at the same moment, actually, when I'm doing a normal physiotherapy treatment for like all these cartilage degeneration, chronic inflammation, having great results. But she's the one actually who marked me a lot because she was super fast. And I was just introducing the oxygen therapy. And I said, okay, it's impossible that in just 3 sessions I had these results, but she's the one actually who gave me the best, let's say, satisfaction so far.
Fantastic. So she started to use hyperbaric oxygen therapy because she needed, and now maybe she do it as a prevention.
Now she comes here 3 times per week.
Wow. Okay.
For preventing further issues or just to be healthy.
Okay.
Because there's one question that is super important for me, and I ask people is, are you healthy or just asymptomatic? That's a key question. If you think about it, you say, that's a funny question because maybe you're feeling okay, but you don't know actually if in your body there's something going on that so far is completely asymptomatic.
So you asked this question before?
Yeah, just to talk. When I talk about oxygen therapy with my patient, I always ask this question because it's a question that makes you think. Because maybe you are in your 30s, in your 40s, you're super healthy. You think that maybe you're super healthy because you eat well, you do lots of sports, you sleep well, etc.
What does it mean to be super healthy?
It means that
it's like you
it's
don't
a good
really
question,
know.
exactly. But maybe because maybe in your family there's some historic condition, or maybe you know better than me how it works. Okay, maybe in your body there's something going on, so you do this treatment in order also to prevent, to stay healthy actually. So that is really a key question for me. A question that made me think at the moment, and makes think, I think, every time I ask this question to my patient. And this is actually one of the thing that push people starting doing this treatment here.
And so this is the question that you ask yourself, but what is the question if I ask you, how do you see the hyperbaric oxygen therapy evolve?
I think actually it will be a key part of everything because of the benefits you have inside the chamber. It can be complementary to what we use already today, nowadays, in terms of medical treatments, etc. But it will play a huge role in terms of prevention and also treating chronic condition way more than how it's used so far. And now I think it's just the beginning. People start to heard about it way more. Maybe they check on internet. I got this problem and it's been 5 years that I'm treating it with no results. Is there something better? And then you find out that maybe hyperbaric oxygen therapy can help you. So I think in the next, I hope very soon, let's say like 5-10 years, it will be actually something super used everywhere.
Something normal that you
something
would do
normal,
it,
exactly,
not
something normal.
As
something
a stranger,
normal.
you see, oh, what is this machine?
Exactly. Because now, this is the reaction. Sometimes people
This
come
is
here.
The future.
They see the chamber, say, what's that actually? What's that? It's like going back to the future or something like that. And I really hope that in the next 5-10 days, 10 years, it will become something popular. Let's say that. Let's go do an hyperbaric session, for example.
What about to have in the future like a room that actually it's a chamber?
It would be amazing. Already, actually, you got, because what I got here, it's a monoplace chamber, okay? Let's say this is actually the brand new, not really new, but it's like maybe 10 years that they create the monoplace chamber, okay? Because hyperbaric oxygen therapy has been used since the 1940s, 50s.
In hospital, no?
In hospital, exactly, with this huge chamber where you can put up to 30 people sometimes. So they're a huge chamber, okay? So it's like 70, 80 years that it's used. It's not a brand new thing, like actually the latest discovery. Okay, so it's something medically approved and proven, okay? But now this is actually the hyperbaric therapy 2.0, let's say that. Creating this monoplace chamber where you can be seated as well, for example, if you got a mobility problem, or actually the chamber I got here, you just lay down and you are like in a bed. So there are different kind of chamber now, like maybe 5 years ago, don't even think about them. So I think that now, because of, as we told you saying before, people start to looking for it way more than before. Even the research and the technology starts to evolve, even if at the end the technology is the same one created 70 years ago. Hyperbaric with oxygen. Super easy.
Yeah. Do you think that the medical healthcare, do they prescribe this to their patient, or like they're apprehensive to this new technology, that actually this technology, it's already here?
For specific conditions treated in the hospital, doctor prescribe hyperbaric oxygen therapy because it has been proven to be super effective. Okay. For all the other conditions, in my personal experience, I got doctors that they know the therapy, they know how it works, so they send people do that. Okay. But I think there's still something that block a bit doctor to say, okay, this is something that can be really useful for lots of different things. Okay. But I think that also this situation is improving because this is something, as I told you before, it's going to explode in a good way. I mean, it will be part of everyday life, I think.
Everybody will normalize.
Exactly. Like now, for example, a doctor send people doing physiotherapy because it's normal.
Yes.
In the future, this will be part of a normal treatment.
So it's not yet reimbursed by insurance?
It's not yet. Only for specific condition treated in the hospital.
Okay.
For all other situation and condition, so far not yet, because especially here, actually, because I'm the first one in Geneva, I think I need some more time. It needs some more time in order to be known a bit more from people. And if there are more centers opening, of course, the more we are, the better it is to ask the insurance to in some way cover the treatment. So
Filippo, one last question. What advice would you give to a medical practitioner interested in incorporating HBOT into their daily practice? I think the best thing is check research and studies, okay, in order to see how in your practice hyperbaric could help your patient. And based on that, I mean, just look at results. And of course now, because it's a sort of a brand new thing, lots of studies and research are conducted on animals, for example. The ones conducted on human show great results. And I think it's just a matter of time that what is being conducted on animals will be done also on human. And at that moment, actually, a general practitioner, I think, will need an hyperbaric oxygen chamber inside his clinic. Wow. Thank you so much for your time and for joining us today. Thank you very much. And thank you to our listener. I hope you enjoyed today's podcast. See you next time.